December 1st is World AIDS Day. The theme of this year is Getting to Zero. UNAIDS says new infections are down by 35% since 2000, and AIDS-related deaths are falling by 42% since the peak in 2004. However, a new report from UN agencies found that AIDS is now the leading cause of death for Africa's teenagers. The report says that half of the world's HIV-positive teens between the ages of 15 and 19 live in South Africa, Nigeria, Kenya, Mozambique, Tanzania, and India, and that only 1 in 3 of the 2.6 million children under the age of 15 living with HIV are on treatment. Experts say it's a huge setback in the fight against the virus. Joining us via phone from Harare, Zimbabwe, is Anurita Bains, UNICEF Regional Advisor for Eastern and Southern Africa. Ms. Bains is attending ICASA, the 18th International Conference on AIDS and Sexually Transmitted Infections in Africa. Ms. Bains, welcome to the program.
Hi, Linord. Thank you for having me.
It's good to have you. So, listen, we're having some good news in the fight against HIV/AIDS, but when we hear what is happening with the teenagers, it's really disconcerting. What are the issues there?
You're absolutely right. For the first time, we are seeing some good news, particularly in getting treatment to HIV-positive pregnant women, what we call PMTCT, and more treatment to prevent new infections for newborns. But the bad news is absolutely in the second decade of life. And we're seeing now through some analysis and data that, as you said, AIDS is the leading cause of death among adolescents in Africa, and AIDS-related deaths have tripled. Well, what's happening is we haven't really understood what the situation is for adolescents and for teenagers. And now we're getting the data, we're having a better understanding, and it compels us to do more and to respond to their needs.
Can this be an indication that perhaps even though we're making very good gains on the scientific level, perhaps the social aspect of the epidemic have not been given enough attention?
The social and broader environmental aspects absolutely need to have more attention. When you look at new infections among 15 to 19-year-old adolescent girls, 7 in 10 are among girls. So, we've known for a long time about the disproportionate impact of HIV on women, on young women in particular, and girls. And now through this analysis and in UNICEF, we're really trying to understand and respond to what adolescent girls need. So first, for the ones who are HIV positive, connecting them to life-saving treatment where they can live healthy, productive lives. And for those who aren't infected, making sure they have the information and the means to protect themselves from infection.
So then when you look at the way forward, we have 15 years left to reach this milestone in terms of getting to zero. What is UNICEF's strategy?
Our strategy is first to draw attention to the situation. For so long, adolescents and the impact of AIDS on adolescents has been a blind spot. So we've seen at ICASA this week in Harare a lot more attention and talk and commitment to responding to the need of adolescents who are affected by HIV. But second, we have to do something about it. So in UNICEF, it's about supporting governments, scaling up high-impact interventions, access to condoms, knowledge, medical male circumcision. It's also addressing some of those issues that you just mentioned, gender inequality, keeping girls in school so that they get the information. It's a broad, comprehensive program, and that's what we need to see, supporting our government in the national program, supporting civil society, and actually working and listening to adolescents themselves in terms of what they need, because they have the right to access life-saving treatment as much as anyone else.
Ms. Bains, thank you so much for joining us. Anurita Bains is UNICEF Regional Advisor for Eastern and Southern Africa. Now, with some major milestone achieved in the fight against HIV/AIDS, many are optimistic that the fight against AIDS could be won. However, some major challenges remained, and only 15 years are left to achieve the mighty goal of eradicating AIDS by 2030. VOA's Pearson takes a look at what it might take to actually have an AIDS-free generation.
The global community has come a long way in the battle against HIV/AIDS. With proper treatment, people with HIV can live long, healthy lives. And if they take anti-AIDS drugs, the amount of the virus in their blood can be so small that it's impossible to infect other people. The U.S. Centers for Disease Control says a daily pill can prevent HIV infection for those who don't have the virus. Dr. Anthony Fauci has spent much of his life working on HIV/AIDS at the National Institutes of Health. He says globally, we have turned a corner on the virus.
If you look at the trajectory of the epidemic, we are on a course towards ending it in the sense of as we know it, because we've always known it as going up, now it's flattening off, and now it's going to start to go down. And we're starting to see that decline.
There are still 37 million people living with HIV, 2 million new infections a year, and more than 1 million deaths each year. But even in sub-Saharan Africa, there's progress. UNAIDS reports that new HIV infections declined by 41% since the year 2000. Young people in the region are at a particularly high risk for HIV/AIDS.
Older men are infecting young women between the ages of 15 and 24, and then those young women 5 to 6 years later go on to infect their young male partners in their 20s. So if you want to change the total course of the HIV epidemic, you have to get older men on treatment, and then you have to implement programs that allow young women and facilitate young women staying HIV negative.
Those most at risk are intravenous drug users and homosexual men. Rodney McCoy is an AIDS activist who is HIV positive. He spoke about what he sees as the biggest impediment to getting to an AIDS-free generation.
Not talking about HIV, not talking about what we do sexually, not wanting to get tested. Basically, that refusal to acknowledge that HIV is still an issue, and that refusal to look at our own risks.
Acknowledging that HIV is real, eliminating the stigma around HIV disease, and getting more people on anti-AIDS drugs is what it's going to take to get to zero. Carol Pearson, VOA News, Washington.
That's our Africa Health Report for today. Back to you, Vincent.
Well, thank you very much, Linord, for joining us today. And be sure to watch for Linord Moudou every Tuesday and Thursday for the latest health news in Africa right here on Africa 54.